Hello and good afternoon. I'm Tammy Papita, Quality and Safety Project Manager at the St. Martin Medical Center. We're happy to welcome you to our expert medical panel forum so that we can answer some of the questions that you, the public, have asked about medical care and treatment at St. Martin Medical Center over the past few weeks and during this pandemic crisis. I now turn the floor over to Dr. Felix Holliday, who will introduce our expert panel as well as the goals and objectives of what we hope to accomplish here today.
Good morning or good afternoon, everyone. I am Dr. Felix Holliday. I'm the Medical Director of the St. Martin Medical Center. Today, I think it's important that we have been getting, of course, a lot of questions from the general public regarding the COVID care at the St. Martin Medical Center. So that's why, in light with our whole team, we think it was important to pose these questions that we've been receiving over the past weeks to our experts in the field. Therefore, in lieu of that, I would like to introduce you to a few of the doctors, the experts who have been dealing with the COVID-19 patients to date. First expert I would like to introduce you to is Dr. Sameh Nadri.
My name is Dr. Nadri. I am internist, and my main expertise is infectious diseases, and I'm the medical coordinator for COVID-19.
Hydroxychloroquine and some antivirals are often used in the United States and in the Netherlands in the treatment of COVID patients. What medical treatment protocols are being used at SMMC for COVID-19 care?
We have created a protocol based on the latest data, which is available internationally in Europe, Asia, and United States. We have used the guidelines from WHO, PAHO, and also CDC, and mainly CDC from the Netherlands. The hydroxychloroquine and chloroquine are anti-malarial medicines. These medicines are used to treat certain malaria disease, as well as treatment for rheumatoid arthritis and lupus. The role of these medications in the treatment of COVID-19 is not clear very well. But we believe that the main working mechanism of these medications is the anti-inflammatory effects. Basically, for COVID-19, there is no drug or medicine available. Usually it is supportive care. But in certain patients, the data show that chloroquine or hydroxychloroquine might be helpful in combination with antiretroviral medications. And antiretroviral medications are medications which is used mainly for treatment of HIV infections. The studies showed from SARS in 2003-4 and MERS later in 2009 that chloroquine, hydroxychloroquine, and antiretroviral medication were helpful against the SARS and MERS. That's why the scientists came with the idea that they might be also helpful against COVID-19. And that's why we are using them. FDA approved only FDA approved these medications only for malaria, for lupus, and rheumatoid arthritis. But they have gave an exceptionally use of these medicines for COVID-19 under certain circumstances, whereby either as experimental medication and a trial and in research use, or in places where the research or trials are not possible. So that's why we have use the guidelines here at SMMC. We adapted and we continue adapting them and updating them and using these medications according to the international guidelines.
How is SMMC monitoring and continuing their oncology treatment care during the crisis?
That is one of the main topics that Dr. Wassner and the rest of the team, we are busy with this topic, because oncology patients are vulnerable patients, just like dialysis patients. The care around patients is complex, of course. Their immune system is low, so which makes them more vulnerable to get additional infections such as COVID-19. So the important issue is to protect them from getting COVID-19. Of course, they are advised to use proper social distancing, hand hygiene, and the other measurements which are needed. The chemotherapy needs to be continued in these patients. So although we know that the risk of exposure to COVID-19 is there, but we have to continue with their treatment, just like hemodialysis patients, that we have to continue their treatment, even though there is a risk of COVID-19 out there in the community, but still the regular care should be continued. It applies also for the patients with oncological care, the patients who need chemo treatment. So we have created certain guidelines to protect the patients in the hospital when they are coming, and our staff are highly qualified with giving the instruction to our patients, and also to avoid any transmission among the patients and the staff, and from the patient to the staff, and vice versa.
Dr. Rajan Steingrover. Dr. Rajan Steingrover is a microbiologist and works as a consultant at the St. Martin Medical Center and the St. Martin Laboratory Service. Over the past years, he has played a vital role in accreditation of our laboratory services on St. Martin. During this pandemic, his role, which is assigned to us at St. Martin Medical Center as an infection and prevention control specialist, and rendering a lot of additional support to that department, he has been at the forefront in guiding the introduction of laboratory testing for COVID-19 disease here in St. Martin at the different laboratories, SLS and HCLS.
Is SMMC testing its healthcare workers for COVID-19 in that they provide direct care to our community? And if so, what's involved in that testing?
Thank you. Excellent question. Let me explain how we protect the community from transmission via the healthcare worker, because that is indeed a factor or a concern, and it should be addressed very properly. We do several things, including testing. Most important thing is when you look around in a medical center at this time, you see healthcare workers wearing protective equipment. You see that entry to most areas is very limited. There's no open areas accessible to the public at this time. Visiting hours are cancelled. Very basic measures. Staff is self-monitoring, so the risk to staff is monitored every day by very simple measures. If there is any risk, any sign, then indeed we test our healthcare workers to confirm or deny they have a COVID-19 infection. If so, they are of course not working in the medical center and interrupt their duties until they are fully recovered.
What is the definition of a recovered patient? Does the island have testing that can determine if someone had COVID-19 and recovered?
I think there are several definitions at this time, and they're all very useful. If we look at a recovered patient, most simple thing is the absence of any disease. So when we have somebody recovered without any sign or symptom for 24 hours, you can basically accept that as a recovered patient. You can also do testing. If you are in any doubt, if there is still infection, you can test to see if you can find virus. I think you all know about the most common test at this time. It is a swab via the throat or by the nose, and we look for the virus in that sample. And if you do that twice with 24-hour interval, you need a formal definition of a recovered patient. There's also another test, less known, but we can test in the blood for antibodies. If you are recovering from this disease, COVID-19, your immune system will make very specific antibodies that we can find with a test. So if there is a history of disease, want to know, you can actually test for that as well in the blood.
The following specialists I'd like to introduce you is Dr. Patricia Rauman. She's an OBGYN specialist and the chief of the medical staff at the St. Martin Medical Center. Her role is, of course, making sure that the functioning and the coordination with the care amongst the specialists continue to flow, whereby also taking into consideration that the non-COVID care also have to be safeguarded. Dr. Patricia Rauman leads the staff on a daily basis during our morning multidisciplinary sessions.
How is SMMC maintaining prenatal and postpartum care for OB patients during this crisis?
Okay, the gynecologist takes care of obstetrical patients, so pregnant patients, but also of patients with female gynecological problems. For the gynecological problems, it's so that if there's an emergency, people can call in, or the house doctor can send them with a referral letter. At the time, we're not seeing regular gynecological patients, only when there's an emergency. For obstetrics, nothing has really changed because people get a waiver, they come for checkups. The checkups are exactly the same. The intervals between the checkups are sometimes a little bit longer. So if people come very early in a pregnancy, we might say, okay, come back in 6 weeks, and normally we'd say 4. But in overall, the checkups are the same. What is different is the logistics. So we try to keep as few people together in the hospital as possible. So there's an interval between the appointments that we make for the patients so that they're not crowded in the waiting room. And it's different when they come into the hospital to deliver. They can only have visitors, and that's only one, their partner, when they are in labor. If they're not in labor but have to be admitted for other reasons, or if they've had a delivery and have to stay longer, or a C-section stay longer, in that time their husband cannot come to visit the patient anymore. Only during labor, the husband can still be there to assist his patients. Also for the private patients, if they would normally have a private room, due to the fact that the layout in the hospital has changed, we don't have private rooms anymore. So you'll be admitted, you deliver, or you have your cesarean, you're in a room with other patients, all non-COVID patients, and when we send you home after C-section on day 2, and then a normal delivery the next day. So the admission in the hospital is less, but people should not be scared that they're among people that have COVID. That's on a separate ward. So we have the delivery rooms on the ward now, we have the baby room on the ward now, and we have all the pregnant women and the people that just delivered on the same ward. So they're not coming into contact with anybody who has COVID. So they can be assured that the prenatal care and the care after delivery is of the same quality. The accessibility to the hospital for them is exactly the same. So it's not like anything has changed really for pregnant women. So they can still deliver here, can still have their C-sections here. Babies can still be admitted here without any problems.
This concludes our expert panel discussion for today. I want to thank all of the medical specialist experts for joining me this morning. We encourage the public to continue asking these questions, and please submit any follow-up questions that you may have based on what you've heard today. We wish you a blessed day further, and stay safe, St. Martin.